Welcome to Luca and Miguel. Enjoy the video.
In this video, I will explain how to care for a ventilator patient. First, always ensure the ventilator circuit is securely connected and free of any kinks or disconnections. Regularly monitor the patient's vital signs, such as heart rate and oxygen saturation, to assess their stability. Confirm that all ventilator alarm settings are correctly configured and understood for immediate response. Maintaining a clear airway is crucial. Perform thorough oral care every 2 to 4 hours to reduce the risk of ventilator-associated pneumonia. Suction secretions only when necessary, always using sterile technique to prevent introducing infection. Remember to reposition the endotracheal tube daily to prevent pressure injuries and skin breakdown. Patient comfort and safety are paramount. Reposition the patient every 2 hours to prevent pressure injuries and promote circulation. Administer prescribed sedation and pain relief to ensure they remain comfortable and calm. For conscious patients, always ensure their call bell is within easy reach, empowering them to communicate needs. Continuous monitoring helps prevent complications. Regularly assess lung sounds and observe respiratory effort for any changes. Be vigilant for signs of ventilator-associated pneumonia, such as fever or increased secretions. Maintain the endotracheal tube cuff pressure, typically between 20 and 30 centimeters of H2O, to ensure a good seal and prevent aspiration.
Thanks for watching and please subscribe. It's the best investment you'll ever make.